All right, so let's talk a little bit about low back pain and some of the common causes of low back pain. There are a couple of different things to consider with low back pain. Let's first go over some of the common structures that can cause pain. These would really be on the back side of the joint here. These are the facet joints. Those can get irritated right through there. We can have the disc itself that can create issues, or it could even end up creating more of an actual herniation that can affect the nerve. Now, when we look at the structures, those are three of the primary things that can really cause pain: the facet joint, the disc itself, and the nerve if there's any sort of compression on the nerve that can cause that pain. Now, from an evaluation standpoint, the big things we want to see is, hey, do you actually respond well to any sort of mechanical changes? So that's where we may look at trying to mobilize the joint into a particular direction, particular range of motion. So do the joints need to be mobilized? The most common direction is backwards into extension, because we tend to bend forward into flexion a lot throughout the day. Another thing we may need to look at is, hey, does the disc or the facet joint not tolerate compression very well? If that's the case, then a lot of times we really need to look at some of our stability exercises, learn how to really breathe and brace and support the spine from the front side, support from the front side, so that the muscles on the back side aren't causing too much compression. Or is it actually something where we need to mobilize the nerve, or the nerve may not be moving as well through the hole right here, that foramen, as it exits the low back? Those are really the big things from a movement standpoint that we really need to look through and see exactly how people respond. Now, some people will show up with a lot of pain, and there's not really a whole lot of crazy findings on an X-ray or an MRI, whereas the opposite can happen, where people have a lot of very significant findings on an X-ray or an MRI, but they don't have a ton of pain. So that's where the evaluation component becomes really important, because it may actually be more of, oh, hey, a tissue became very sensitive, more so than just a structural change that's really causing all of the pain. So the sensitivity factor really has to be addressed, and that's really done through the evaluation process of seeing how people respond. Now, the other side of things, from a non-mechanical component that could be causing things, are more of a chemical irritation. So something like a new fresh disc herniation could actually have a chemical exposure component with inflammatory cytokines like TNF alpha and interleukins and those kinds of things, which, if that's the case, then we need a chemical intervention. And that might be something where we are looking at more of our NSAIDs, looking more of our steroids and those kinds of interventions. So question is whether or not the pain is primarily from a mechanical or a chemical cause. And then if it is from a mechanical cause, what is our intervention? What needs to happen to help desensitize the structures that are irritated? And that's what the evaluation, that's what a lot of the exercises and the rehabilitation, the manual therapies, the manipulation, spinal manipulation, a lot of those things really come into play to help handle that sensitivity and get people back to function.